We are studying a cardiopulmonary rehabilitation program combined with supplemental oxygen for COVID-19 long haulers. My collaborator on this research project is Dr. Noah Greenspan, who's a physical therapist in New York City, and I initially connected with him as a patient. I got COVID-19 in March 2020 and never got better. In fall of 2020, I went to New York City to work with him, essentially as a guinea pig. And the treatment, the program was successful and helped me recover. And while I was there working with him as a patient, we also started to develop a more structured way of studying the efficacy of this treatment. So my work in this project is informed not only by my research background and experience, but also by my personal experience as a COVID-19 long hauler. What we think is going to help COVID-19 long haulers is combining supplemental oxygen with treadmill exercise. And the reason why we think this will work is that oxygen helps reduce post-exercise inflammation. So what this means is that people who get COVID, and as they start to feel better, they then push themselves, particularly because we're predominantly talking about people who were previously athletes and healthy. And when they do, they crash. They have a resurgence of their symptoms. And so what we're trying to do is to find a way to retrain the body to react appropriately to exercise, but not to induce that crash. And so we're doing that with supplemental oxygen, which cools off post-exercise inflammation. And so we think that that will be an effective treatment for some COVID-19 long haulers. We have a long-term goal of getting funding from the National Institute of Health to establish a cohort that we study longitudinally, because we don't know what the effects of this pandemic are going to be on both health and mental health. And so we want to be able to study people for 5, 10, 15 years to see down the line what the impact is.